Hey, it's Jessica DaMassa with WTF Health. I'm here at Health Datapalooza, and joining me right now, I have Peter Lee. He is Corporate Vice President for Microsoft Healthcare. Good to have you here.
It's great to be here. Thank you.
Okay, so we're going to start out. I want you to do some rumor dispelling for me. So I heard a rumor that Microsoft Healthcare is your big healthcare play. You're not going patient. You're not going anything crazy like that. You're going enterprise instead, which makes sense to me because of just Microsoft's history in terms of workplace software and things like that. So is that true? Are you guys going to head toward the back end, help hospitals figure out their data problems and their interoperability issues, or what's the play for Microsoft Healthcare?
Well, I wouldn't say that we're ignoring consumers. In fact, we have new products out in market just recently, such as our HealthBot, which is really something designed specifically for consumers. But for sure, we're in this era right now where we're seeing thousands of healthcare organizations thinking so hard about the cloud, thinking about AI, thinking about how to extract the most value for better outcomes and lower costs out of their data. And so we're desperately trying to help them create success for them. Right now, Microsoft has 169,000 commercial relationships in the healthcare industry.
169,000.
Yeah, over 140 countries. Everything from a one-nurse clinic in Kenya to Kaiser Permanente, United Health, and so it's and everything in between. And what we're seeing in the very leading organizations is they're thinking incredibly hard about cloud and AI, and we think that those leading organizations are going to set a pattern for the next 10 years, and so we want to be a part of that.
Okay, so give us the scoop then. What are these guys worrying about?
Well, you know, one thing that's been surprising to us is can you trust the cloud? Is it secure enough? Can we maintain privacy and compliance? And I think it is sometimes surprising then to the healthcare industry that, in fact, the cloud provides tremendous benefits for security. In fact, you know, if a typical organization on its own might deal with 10,000 cyber attacks and incidents in a year, we're doing that every second. And so there's just an amazing ability to provide absolutely the top best insight into cybersecurity. But the real benefits end up being with global deployability of intelligence.
Okay.
The AI, so the cloud really has been the receptacle, the delivery vehicle for a rapidly maturing set of services around machine learning and artificial intelligence. On our cloud, we have on Azure something called Azure Cognitive Services. And Azure Cognitive Services now have matured to the point where they're HIPAA compliant, high trust certified, really viable for clinical applications. And these things now are just in this ability to support new and emerging data standards like FHIR. And so you put that all together, and you suddenly have an application platform that is really just ready to go.
Okay, paint me a picture for those who may not be so up to their eyeballs in data and understanding machine learning. What's possible on that platform then? That can be built. It's ready to go, you said. So what can I do with this?
So I kind of see three big buckets.
Okay.
And those buckets have to do with population health analytics, empowering doctors and nurses and patients on the front lines have better experiences, and then third, providing the foundations for a future of precision medicine.
Okay.
And those are all really important, and they have such big AI things. And so maybe just to keep it brief, the one that's nearest and dearest to my heart is just providing these tools that not only help doctors and nurses be more productive, make fewer errors in what they do, but just increasing their satisfaction in their day-to-day work. There are so many kind of burdensome regulations now around, for example, clinical documentation. So much of that now with emerging AI, we're just on the verge of being able to automate and dramatically reduce those burdens by having AI systems that can listen, say, to doctor-patient conversations, set up the clinical note, identify errors, and really accelerate what people do. And just put doctors and nurses back into the situation where they can just focus on the patient.
Yeah, and enjoy their jobs. I mean, physician
That's
burnout,
right.
I mean, it's awful. And a lot of them point to the fact that the technology that's in place is just not, it's lacking. It's lacking a lot of the ability that they had to just deal with their patients face to face.
Well, and then we're learning so much more when we think about precision medicine. we are finding amazing connections. The same machine learning technology that, say, translates Chinese into German, those technologies we're finding are able to translate the genetic markers in your adaptive immune system to the diseases that your body is fighting right now. And so, over the next decade, I think we're just going to see some transformational impact from all of this AI.
Okay, what are you most excited about that? I mean, those are the things that Microsoft is excited about and that you and your role at Microsoft are excited about. But I mean, when you look ahead to the next 5, 10 years, I mean, what really do you think, what's the thing that blows your mind?
We were talking about these empowering tools that do a bunch of automation for documentation, and we can talk about reading and decoding the human immune system. Yeah. But while it doesn't sound so sexy, data interoperability just thrills me. And
I love that. It's such an honest answer.
and because all of this ultimately is driven by data. Yeah. Data ends up being the fuel for the future of healthcare. And so the things that we're doing now to provide really compliant and highly kind of liquid health data are just so important. And right now, we're in this historic time. Right now, the health industry is shifting to the cloud. It's involving a bunch of leading organizations now, and they will set the pattern for all the rest of the industry over the next decade. And so we have this opportunity to ask the question, what specific interventions should we make right now so that as this shift takes place, we end up in a better spot 10 years from now than we are in today? And that's just an incredibly kind of exciting thing. To be living in that era right now and working on that is just an incredible privilege. You know
what's coming, right? So what specific interventions would you recommend that we build right now to set us up for success 10 years from now?
Well, when you find out, please tell me.
Oh, okay.
No, but seriously.
No, ask yourself your own question. I think that's a great question.
It is.
We have a big innovation audience. So, what would you say?
So, one thing for sure is that we've decided that health data is going to be so fundamental that it is not a separate platform concept in our cloud. It has to be deeply embedded in the very core of the cloud. And so when you look at the evolution of the Azure system today, that means support for things like FHIR, DICOM, HL7, and all the converters and so on are going deep into the core of the operating system of our cloud. Okay. And that means that it is on the same level as all of the other fundamental kinds of data that the world lives on today. And by doing that, what you're trying to ensure is, first of all, we hope to put competitive pressure on our cloud competitors so that they do the same thing. We think it's important for all of us to do this. And then, as this shift takes place, we end up being in an ecosystem where fundamentally, at the very core of all the computing infrastructure of the world, the default frictionless situation is one where health data is liberated, is really capable of moving freely while protecting people's privacy.
Well, in the words of Tad Park, we'll leave it there. He said to me earlier today, "Viva la data liberación." Peter, thank you so much for joining us. It's a pleasure to talk to you.
Thank you. It's been really fun.
Thank you. I'm Jessica DaMassa with WTF Health here at Health Datapalooza. Thanks for watching.